My name is Carrie Ann Crockett. I'm an obstetrician gynecologist in Eastern North Carolina. I'm here today to tell you about a new law now in effect in our state. Dignity for women who are incarcerated was passed by the North Carolina General Assembly in 2021 with broad bipartisan support. It was signed into law by Governor Cooper in September and went into effect in December of the same year. This law provides guidelines around the basic care and treatment of women in the carceral setting. A few key points to be aware of. First, this law significantly limits the use of restraints or shackles or cuffs during pregnancy. With very few exceptions, restraints or shackles or cuffs are not to be used, and when used, only wrist restraints in the front of the person's body are to be used. Second, the law prohibits the use of body cavity searches during pregnancy through 6 weeks postpartum. And third, the law prohibits the use of restricted housing or solitary confinement during pregnancy and the postpartum period. There are a couple additional provisions. The law specifies that pregnant individuals be provided a bed that's no more than 3 feet off the floor, be allowed certain nutritional and hygiene products at no cost, be provided sufficient food and dietary supplements that fall within a generally accepted prenatal diet. The law specifies that prenatal labor and delivery care be provided with no cost to the incarcerated person. When an incarcerated person is hospitalized, they be allowed the full range of hospital meals available. And finally, barring any medical complications, a newborn infant should be allowed to remain with the patient for the duration of their hospitalization. There are a couple other provisions that apply to the mothers of small children. First, for those with children under the age of 1, they are to be placed whenever possible in a facility within 250 miles of their child. Second, when in a low or minimal security setting, they are to be allowed 2 contact visits per week with a child under the age of 1. And finally, a couple guidelines that apply to all women in the carceral setting and not just related to pregnancy or parenting are: 1, whenever possible, inspections of an undressed female incarcerated person should be done by a female staff member. And finally, menstrual products should be available to all female incarcerated people who need them at no cost. It's important to mention that there are some exceptions to each of the things that we listed above, and there's also associated reporting guideline that goes along with those exceptions. So whenever an exception is made, there is a requirement for the law enforcement officers involved to report that. Now that the law is in effect, it's important that anyone who works with incarcerated people be aware of the law and be aware of what to do if they suspect that they see a violation of that law. So the first thing is just open communication. If you suspect that you see a violation of the law, talk to the law enforcement officer who's there with the incarcerated person that you're interacting with, and tell them you're aware of this law and you're afraid that what you're seeing isn't in compliance. If the officer refuses or are unable to make any changes or any adjustments to what they're doing in the situation, you can ask for their supervisor's contact information or whoever's next in the chain of command. You can also go to the northcarolinasheriffs.org site, and there's a sheriff's directory, and so you can find the contact information for every sheriff's department in the state. You can report the incident to your supervisor. As this law is being incorporated into our society, that facilities and different institutions become aware of it and how to be in compliance with it. And then finally, you can report the incident through incarceratedwomenshealth.org. There's a link provided to you, and there's also a QR code that will take you to that. And it's important to note that this tool is not meant to be used for legal or punitive purposes, but is more a data collection tool, can help target future educational efforts.
For more information, visit incarceratedwomenshealth.org.
Thank you so much.